Hello and welcome to HFMA Talk, the podcast for NHS Finance. I'm Catherine Mitchell, Head of Costing and Value at the HFMA. In this episode, we listen in on a conversation with three senior NHS colleagues. I'm delighted to welcome Nicci Briggs, Mike Emery and Sonia Patel, who will discuss how digital technology can support the NHS in overcoming its challenges.
Welcome everyone, I'm Nicci Briggs. I'm CFO for Cambridgeshire and Peterborough ICB and I'm chair of the HFMA Digital Council.
So I'm Mike Emery. I'm now the Director of Digital Data and Technology for Herefordshire and Worcestershire's Integrated Care Board.
So I'm Sonia Patel. I'm currently the System Chief Information Officer at NHS England and responsible for all things levelling up digital maturity. I'm really pleased to be with two individuals that are very on trend at the moment, given the birth of collaboration on the 1st of July. So I'm really pleased to have this unplugged conversation with the leaders of the future.
I think it's a really exciting time about what we can do at the moment. Potentially, there's a lot going on. It's how we draw people together. I think it's the challenge we often have in our system, and getting people to recognise. I think you used the term levelling up. How can we get everybody in a similar place with regards to the foundations or their digital foundations they've got? That's one of the big challenges we have in our system, which is probably preventing some of the things we'd like to do. But excitingly, I think there are opportunities now, and that is recognised by the centre, that we've got to get everybody to the same place. Otherwise, different parts of the system and different individuals and patients won't have the access to services that they all deserve. So I think it's a really good, opportunity that integrated care boards have, working with partners in different trusts.
And we've got to get behind it, right?
Yeah.
So if the ambitions for ICSs, which actually builds on lots of international evidence where they have gone further with integrated care, is we've got to get behind those quadruple aims, which are from improving outcomes, tackling inequalities, value for money, and broader social and economic development that healthcare can bring. And for me, it's underpinning that. We talk about digital, but it's data. And it's so important that we have the right data to drive the right conversations, right decisions for local places. And, the data assets that are going to be driving that conversation are care data assets, workforce, just kind of knowing where our estates and where our equipment is, all the way from finance data. So it's so important we have the right infrastructure to capture the right data at the right points to be able to serve people. So we've got a big job to go together, but how great is that we're doing it across health and social care? So we're working equally as partners, and we've got a license to do that. So there's been great collaborative work over the last few years, but really to have a kind of cemented into the act now, really, I think paints a kind of very optimistic future around how we are less competitive but more collaborative. And I hope that brings new opportunities of how we allow for the kind of pound to go further across health and social care too.
Yeah, I think, Sonia, it's quite interesting, and we were using the word levelling up in the NHS, where we've got fantastic innovations. We've got robots doing, surgery. We've got some of the AI work and overnight processing of invoices and recruitment work and contracts and so on. Yet, I think the public could probably be surprised to hear we don't have a shared care record across the NHS. So I think that's, although it seems like one of the foundations, I think it's going to be the biggest turning point for the NHS move into that kind of shared care record. As you say, the data behind it, just that the ICB should represent a seamless NHS. To do that, the digital and data needs to represent a seamless NHS as well, doesn't it?
So the ICBs help us as a new organising unit, right? So ICBs have lots of opportunities around ensuring that we are not doing any one piece of kind of digital development more than once in a given geography. So we're making sure we're getting efficiencies and the right clinical adjacencies for the patient population. And And we recognise in any given ICB there could be quite a lot of disparity around just the basics, like you said, Nicci. You know, if your clinical records are not digitised, it's going to be really difficult to share those records, not just within health but across social care. So we've got to make sure we get the fundamental building blocks in place for every ICB in order for that ICB to prosper around actually sharing records. And then, you know, the place where we really want to do is around actually the population health data sets to be able to manage the citizens' health.
I think there's a few things in there for me. I think I've often said 2 or 3 years ago, when we did a very wide engagement exercise of clinicians and colleagues around our digital strategy, there were two things. Yes, the data, but there was also the comment, don't get overexcited about artificial intelligence until you've got Wi-Fi. We've got Wi-Fi working and you give me a laptop that works. So we heard that loud and clear, and we've been working on that. And I think actually the last 2 or 3 years allowed us to really drive that forward. For me now, we're actually at a place where we've started to respond to that and actually get into the exciting stuff, which is pulling that data together, because the data is starting to flow into a central resource. And already, just around patient care, we're very, you know, a lot of areas have got this, but one of our local hospices that now can access all the information from the acute community social care, you know, sectors in our shared care record, and it's made a huge difference for them around when they're caring for patients or end of life care in the local hospice. And they're now feeding their information in. So it's how we bring some of those independent providers in as well with the care planning. So that's really helpful. But from that data now, we're now starting to use it to identify, well, how can we get, you know, on some of those pathways, earlier interventions to really make a difference. And I'm always reminded of this story that someone told me, that we were noticing, we did a bit of analysis, we were noticing a certain cohort of people were having a high level of falls. And we analysed the data and discovered there was a correlation with the number of people who had not taken their eye test 6 months previously. So actually, the trick, you know, it's that kind of bringing that information together and identifying some of those interventions, you know, from the data sets that really makes the difference on the ground. And I suppose the other thing I'm always minded of, you know, that informs us about where we can go, but also it's how we use that data to measure the impact. And that's what I'm also excited about, because I think in the past we've tried lots of pilots and trials, and sometimes without that data, we can't measure the impact that some of our interventions are having. And I think that's going to be really important as we start to develop new ideas and new delivery mechanisms.
And I think, going back to Sonia's kind of 4 aims, it will have a massive impact on how we start to address health inequalities. So we've similar to you, Mike, we've got examples where we were looking at outpatient DNA rates, and actually when you have the data and you store the information and look at the cohorts of people that were DNA, and it was a particular community. And once we then set up a telephone call system, you know, not blanket for everyone, but for this particular community, we went from, you know, DNAs in the high 70s to DNAs of less than 2%. I think digital helps you to narrow the focus and narrow the area, so that you don't have to put in manual interventions everywhere. You put them in for particular communities, and then it absolutely has a fantastic impact in terms of, you know, that equal access to services and increasing sort of the, you know, care and the health inequalities aspect of the work that we need to do and what we fundamentally need to use digital and data for.
But it's a set of building blocks, right? If we're trying to achieve this. So, you know, you've got to get your bricks and mortar right in order to then kind of fill the house with the right capabilities that you're able to kind of run that house in an orderly fashion to the right budget. So, you know, it's for me, there is about making sure that the bricks and mortars across any ICB are well in place and, you know, not on shaky foundations. And the people that are using it have a delightful experience of using the technology. Now, that's quite a hard bar to set, because actually, given our diverse workforce, delightful means different things to different people. But it really is, if we can't give a better experience to our workforce in using this technology, we're not just going to, we just won't get the quality of data in to be able to do the more sophisticated things we want to do around operational delivery, strategic planning, planning over a longer horizon for population health. So it's absolutely key. I think there's a lot there in terms of digital and data helping us rise to some of the challenges we are facing in the NHS around sort of backlog recovery. But equally, I think there's also challenges around digital and data itself. And one of my concerns is we've got a lot of investment going in from the centre. Lots of work is done in partnership with the system around digitising kind of workflows and getting to places where we have pretty much the nation with some coverage of shared care records. So there's a lot of investment going in, lots of work also to increase this in channels. But on the other end is we really need to be planning for the future around sustainability of this digital tech. Too often what we find is the short-term investment is great, but actually there are concerns about it coming off the cliff edge because we have not planned for the run and maintain of that investment and service very well locally. So I think whilst it brings the challenges, we need to face those challenges so they're sustainable kind of capability in the future. And you know, technology as a revolution is fairly new. And so we need to kind of help guide, I think, from the centre in partnership with local, what is the optimum sort of run and maintain investment line for ICBs on digital and data? How do they have a reinvestment portfolio into new digital and data tech? How do they, you know, how do you ensure that you are running at sort of minimal tech debt, but optimizing the capability that you have? And I also have a principle, and this kind of will leave us food for thought, is the more and more I've had conversations with colleagues across the system, we've got a number of big challenges aside of some of the kind of care challenges we face, which is a striking workforce challenge in digital and data. We are in a serious shortfall of resources that we want to attract into healthcare. We're left in some cases competing with each other for similar resources, and that's in an industry backdrop where we don't have enough resources. So there's a guiding principle for me is where we do have resources on the front line, we should be shifting them to do high value digital and data capability, and we should be looking at standardizing or scaling sort of are you hesitant to use the word low value, but sort of things that could be done that could ease the burden on local organisations in the front line to a scale that could be done much better through automation and through sort of a lower resource pool. And that value shift, I think, is something we probably need to start thinking about, and that happens at the different levels, from organisations to ICBs to regions, and regions to national, around the scaling level of sort of more of low value stuff moving up to the centre, more high value stuff being able to be delivered by the scarce resource locally.
I'll sort of reflect on that from where I sort of sit. Very evident that it's really, really pleasing to see that there is that investment, going into digital and data. The risk for me is how then can I deliver that when we're looking for those highly skilled people? And we've had several adverts out for program managers and it's very challenging to attract the talent, particularly for what I'm going to call a more not so much high profile ICS. We're in Hereford, Worcester, we're near to some of the big centres like Birmingham, where there are lots more tech industries, and that attracts young people and the like. And we increasingly are having those conversations at our ICS level around how do we consolidate our resource to support one another with some of the skill sets. So there are some skills, particularly I think this really, we've got very few people who've got a really in-depth knowledge around what I call the diagnostics clinical systems. That's a real challenge for us. And we're having often to recruit or look for a lot of consultancy support. But actually, we're struggling to get that specialist advice, expertise, one or two. But the only way we can do that is consolidate around one or two people to provide the support for the whole system. So some of that skill set, you could think, well, actually, we could think through how we could do that at a broader level across a regional base. But we have taken advantage of one or two larger pieces of work, so around remote monitoring, virtual care. We've actually got a team that goes across 4 ICSs in the West Midlands around one particular programme, and that's working with 1 or 2 partners in commissioning support units as well. So we are trying to do that, but it's not as systematic as you know, it's not that systematic thinking so much. It's all, at the moment, it's been opportunistic. So I think that's, I agree with you. What worries me is we're trying to work and deliver, you know, digital maturity at pace, but and I think that's what we need to do. But I feel that we may struggle to resource it. The only other thought on that, on the workforce, what we are doing though, is doing some thinking around how we can engage schools and colleges more to actually say, actually, the NHS is not just about the clinical world. It actually is a very exciting place to work around technology. So actually, we've been very fortunate, and I think somebody's been there. We've got a small innovation centre we've built. We're starting to bring in. We're going to bring in schools and sixth form colleges to, you know, so people can think, well, this could be a career for me. Now, we're never the real brightest may go off to the Google Health, but there's a really strong cohort there that may want to work more local and have the, you know, the intellect to work with us and the desire to work with us. We want them to see the NHS and the tech industry, you know, digital and data, to be a career for them. So I think we've got to do more of that promotion and make it interesting and make it exciting as well to that cohort of people.
I agree, Mike. I think we've got to find a way of being able to grow our own. And like you say, offering, you know, almost apprenticeship schemes, but allowing them to get qualifications. You know, it means having to potentially fund a bit more in terms of training expenses, but it's much less than consultancy or agency and things like that. And it's how we can use that across, as you say, I think across an ICS is good because they can get exposure to all different areas, the acute, you know, mental health, as well as the kind of central teams. I think it'd be interesting what NHS England's approach to it is in terms of that. But I know that other systems have just kind of abandoned the thought of being able to recruit and have gone into partnership, haven't they, with big organisations and effectively asked for that. But I think I'd like to see a world where, yes, you partner with some of the big tech companies, but actually they help support and do like rotations for your own staff. I think, you know, almost writing into big contracts to say, well, yes, but you need to offer the opportunity for our team to come and do placements with you, to pass on that knowledge, so it doesn't just sit in high profile firms and big contracts.
I absolutely agree. We need the best solutions to sort of supply in some of these roles are going to be place-based solutions. And I think that fits into the wider aim of social and economic development for ICBs and ICSs. So if you can, you know, if you consider your demographics and where you might get that sort of kind of pool and pull of talent, that's one where actually you could kind of develop it for that place would be fantastic. And we, you know, there's some thinking we're doing from the centre. If that becomes the kind of strategy, what frameworks do we create nationally, boot camp, centre of expertise that helps upskill colleagues? I've also got another thought about this as well. So whilst we focus in around digital and data roles and expertise, is it time that we now need to democratise digital? So a lot of the digital has been done by digital data experts, but you know, most individuals can have it at the touch of a button on their phones and develop. So how do we create the approach that sort of digital leaders and systems can work with their finance peers, their procurement peers to create capability which could be further developed by other professions? And I can't see why we wouldn't do that, because if I look at HR don't do all the recruitment. We do recruiting as recruiting managers for our own profession. So a very similar approach. What could we put in place around some approaches, some standards, and allow for that democratization? So this is a CIO that was really hot on shadow IT, saying, actually, we might want to go the other way, reverse it, and say, actually, maybe time has come that democratization of digital is probably the right way we want to go, particularly if we can't handhold every digital and data development. And actually, if we want people to have greater ownership and take, but actually we need to find some routes that allow different professions to kind of champion and take that forward as well?
I think that's really important. What I've learned more than anything that I did, we haven't mentioned the C word COVID over the last few weeks. We were far better at problem solving for the system as a digital team when we had a multidisciplinary team, people who weren't necessarily digital experts, but we had strong clinicians, people who understand pathways, and finance leads coming together with us to problem solve. And that allowed us better to understand the user experience when you had clinicians on board, and actually develop solutions that would would actually respond to some of the problems we faced. And increasing, just this morning that I was talking to one of our deputy chief nurses in the ICB, who's probably going to take on a CNIO role, and she said, "Oh, I'm not necessarily the most technical, but I really see the value in this for transformation. Help me learn, help me spread the word." And it was exactly, I was going, "Oh, right, I've got an open door here. Here's someone who is nervous about it, but actually can see the potential for it." And actually, it's easier to sell the idea if someone like that comes on board and then acts as an evangelist and starts to spread the word, engage with the changes. Then actually, here Mike comes again and bores us to death around a particular digital technology. It's better to come sometimes from that frontline staff who have seen the benefits and actually really want to spread the word. So I totally agree. I think we need to, up the profile.
And I think clinicians are some of the best way to tap into that. When you look at talking, when I worked at the acute sector, talking to medical students, they do tours of hospitals. They go to some big tertiary centres where they've got all of this technology, and then they move to the smaller acutes and are wanting to bring that. And actually, there's sometimes a fear factor, isn't there? But when you give them empower them, I guess, as Sonia was saying, to actually own it, and make that innovation, that transformation, it's really positive. There's a couple of examples that I can think of straight away, where it's dead easy and dead simple for people that have used it before. But things like 3D printing, it's absolutely transformed a service when I was at Kettering Hospital with regards to MaxFax. So what they were able to do was 3D print the inner ear. And 3D print, also obviously impressions of teeth and things like that. So there's MaxFax was the kind of teeth point, but EMT, it was some really complex inner ear procedures that surgeons only do once or twice every so often. But the fact they'd be able to 3D print them meant that they could practice before they went into that kind of surgery, increasing confidence, reducing error rates. It's just absolutely opened up, and they're such a small investment, but actually the way they can transform a service is massive. And again, you don't need to be some kind of IT or software expert to be able to install them. It's effectively just making sure that you've got decent laptops, decent Wi-Fi, as you say, that the hardware is there to link in. But actually, there are lots of clinicians that have used them and want to be able to use them. And again, it's just I think some of it is a case of organisations not understanding the benefits that they can bring. But they are, they're huge, and it's such a small investment. And it goes back to that Sonia's point of almost, how do we delegate much more around the digital agenda and improvements that need to be made, and let people go ahead and do it. And sometimes it's, how do we make sure when we've established ICBs? One of my greatest fears is that we build back too much bureaucracy. What we need, particularly with the digital agenda, is to try and make the governance side of it extremely simple. ICBs, I'm already hearing about scary things about how many conversations we have to have in terms of information governance. Well, we should be able to sort that out surely between the organisations, so we don't have to put such barriers in place for people to do the simple digital investments that they need to do.
With the whole opportunities of collaboration at scale for local geographies, we also need to shift our mindset around it's not just grouping of activities, but allows us to kind of reflect around doing this slightly differently. How do we create a more permissive digital and data environment, all the way from the IG to ensuring we've got the right cybersecurity, ensuring fundamentally that we've also kind of considered the run, maintain investment too, into a place where we are maximizing scarce resource to do the right things, and allowing our workforce to champion much more technology that is meaningful and useful to them. And that's quite a big shift to take, because we've got a backdrop as well of trying to get some standards in place. So we've been talking about standards and interoperability for some time now, and we really need to get serious about that. So if we want to create a kind of helpful ecosystem, I think there's also some things that in the centre we are working on that we really need to help local, because it can only be done at the scale of sort of national too. So I'm still very optimistic. I came from what was, if some of you might remember, we started off life as a vanguard and then a pioneer and then an STP and then a partnership group and then an ICS and yeah, and when you see over time the opportunities that strike from just conversations between colleagues, is fantastic, particularly when they put sort of given organizations aside and just really think about the kind of benefits they're driving for patients and citizens. You come out with some really unique opportunities. We also did something which I think should be a model for future ICBs, which is we had lay partners on our boards. And I think that was helpful because it helped hold a mirror up to ourselves around, are we having the right conversations to support our patients? Or are we getting stuck into sort of bureaucracy, as you say, Nicci? Could end up in a place where, unfortunately, sometimes we end up in that space because, you know, we put enough minds to it and we end up with a new protocol or a new set of criteria we need to meet. But yeah, having lay members and kind of keeping it real through the processes is quite key. But the opportunity is immense, I think, in digital data. I went to a visit this week in North Anglia, and it's the first time I've actually seen a digital histopathology department, but how they were using slides and being able to review slides and the capability that AI could enhance the reporting experience of the clinicians, to provide quicker turnaround times, to support multidisciplinary conversations, was fantastic. So it's just like, we're talking about building blocks, but now we're kind of starting to see the value that, you know, small great bits of technology can provide sort of kind of clinical professionals is fantastic. And, you know, our first instinct was, can we scale this across country? The cost, the kind of, how do you mainstream it? How do you change clinical pathways? How do you change the workforce as well to support that new technology? So in some ways, we need to get the building blocks right, but we're just on the cusp of the opportunities that exist across healthcare.
I think there's some really exciting opportunities. I'm glad you mentioned about lay members and non-executive directors, because I'm proud to say that our chair of our digital data board is going to be a lay member and non-executive director, and we're bringing other people on board because we recognise we needed that mirror held up to us. And I think that, but we've often said locally, we think we're so close to doing some really exciting work. I mean, you mentioned North Anglia in Hereford Worcester. We've recently run an AI tool on some of our TNO waiting list, and to review the waiting list, and what would have taken a clinician, a group of clinicians 30 to 40 hours, it was done in 5 minutes. Now, it's presented an interesting ethical dilemma because it's helped as a clinical decision support tool to stratify and prioritise those on the list. But of course, some of those have got longer waits. So you've got this balance now between, you know, is it about clinical priority or those waiting lists, you know, the length of wait. So that's some of the dilemmas we're having to think through to find that balance between obviously meeting some of the targets we've got nationally, but also about how we use that sort of clinical decision support tool to influence how we prioritise some of the waiting lists. So I think it will be interesting around some of the you know, what will this flush out in the way we think around using some of that data, the way we think and we analyse data, but how we can more comprehensively and in a smarter way analyse and diagnose conditions. So I think it's a really exciting time, and actually, we are beginning to see a lot of people suddenly recognise the potential. And going back to, I think sometimes it is just showing people the art of the possible, and that's what we've done on one or two things. So you went back to 3D printers. We've got proper simulation suites set up now with augmented reality and VR, and it's incredible what you can do by putting on your glasses and seeing a skeleton in full 3D and move it around. I think we talk about the smart foundations, but we also need to excite people about what we could achieve in the future as well.
So much to go after, right?
Yeah,
Um,
definitely.
Yeah, but we also have got to make sure we're putting the right support in for our workforce around being able to kind of champion the right capability, but most importantly, because we are discussing this amongst the HFMA community, is actually the run and maintain investment that's required.
Yeah.
So one of the things we also need to be kind of laser focused on is, what do we decommission? So we can't just inevitably keep putting new digital technology on without fundamentally making some change to take on that new capability longer term. And my question always is, okay, if we're doing this, what are we decommissioning? Because there's got to be. So I think when we're setting out new opportunities, we've got to be really focused on making sure we are taking out unnecessary sort of effort and also potential waste as a result of kind of the new benefit coming through.
No, I don't think. Well, I mean, we're like all ICSs have a significant, I'm going to say, best use of resources program or savings plan, both on the cost savings, but also improve productivity. And even if it's as we go, about doing more for less, and it's some of that low value using robotic process automation to free up people's time, and we could possibly look at flat cash growth and so forth going forward in the way we measure it. Is something we are very mindful of, but it also brings me to thinking through of areas as well as working in greater collaboration around procurements as well, and where are we duplicating our spend and working with the supplier market. I think there are huge opportunities there. We've just done some, you talk about the national level, but we've just done some mapping work locally, and not only the overheads about 5 different organisations interacting with the same supplier. Why do we not have one contract with that same IT supplier and manage it singly? We're also trying to, on scale, driving out some of the discounts. So I think it's huge. There are big opportunities on just even that more prosaic management of suppliers and procurement side that we need to think about as well.
We kind of need the ecosystem of vendors, suppliers, and buyers, both nationally, regionally, and locally, to kind of really work through the kind of future challenges.
And I think for me, it's around, we've had a number of conversations across the HFMA about assessing those benefits as we've talked about, but it's our thinking is very much in terms of, and most of the way that we process things like business cases and investments, it's either long term, i.e. your big kind of estate schemes, which are multi-year business cases, or it's equipment, which is your general life of 3 to 7 years or so on. And I think in terms of digital, the investment might be over that shorter term period, but the benefits are much longer. And I think that's where we often struggle, isn't it? Because it neither case fits fits perfectly from a digital perspective. So, and it's been able to quantify, because I read a number of case studies that say, well, digital actually adds to the cost, which it does in the short term, but actually it's trying to put a value on that kind of clinical time and how the benefits and the value that you get off the back of it.
Yeah.
And if we looked at the prime example, isn't it, is something like the shared care record. The cost of that across the NHS will be quite significant, and initially it will just look like an additional cost for systems and organisations. And yes, absolutely, we've received some funding for it, but the sustainability of things like that, as Sonia talked about, is, well, where is the time saving? Where's all of that? The people having to spend half a day searching for patient numbers on 3 different systems. Where were we able to capture that and truly see it? Because my worry for a lot of the digital innovation, particularly when it's around data, is how do we prove that it's successful and people don't just either stop it or effectively say it's just a cost.
You're right, it's how we capture it. I mean, we've had local GPs saying, I used to spend half a day chasing up these records and that information, phoning people, leaving messages. I had it to hand in 30 seconds. And it's those sort of things that's anecdotal, but I think we need to sort of lay that out in a more coherent way and capture those benefits. Whereas I think the risk is that everybody just sees the big pound sign of the upfront investment. What does worry me, though, we need to capture that. Going back to the sustainability point, we're at the point now going, well, actually, how are we going to continue to sensibly, support the development of that clinical system and the maintenance more broadly, across the system? Because we often have clinical support teams in trusts, but some of these systems are multi-organisational support required. And to do that, I'm having to work through the benefits and saying this is what is saving you. So I think it is sensible to invest in this for the longer term maintenance and sustainability. So some of the work we're doing, and hopefully we'll be reaching out to other areas that are hopefully slightly further down the line than us around some of that.
What do you guys think will be kind of the next, if we're looking at the next 5, within 0 to 5 years, what do you think are the key digital improvements that we should all be looking at across the ICS?
So for me, I think leveling up says it all, really.
Okay.
You've got to make sure you've got sort of ubiquitous infrastructure capability. You've got to get your EPR strategies, which is your source clinical record or care record systems, in place, making sure you're able to join up those records. I think in that process, you need to make sure you're simplifying at every opportunity across an ICB rather than adding in additional complexity because you've got the opportunity to collaborate at scale. I also think through that process, I think there's a lot more value shift as well. So to think about what things should be done at scale and only done once at sort of the right bits. I think fundamentally alongside that, I think working to open up greater digital channels for our citizens is going to be fundamentally, I think, the sea change that we're going to see. Because at the moment, I think we're only on the kind of starting journey of actually through the COVID pass. There's an acceleration of people kind of getting more interested around accessing the app. I think using that as a way of interacting for an individual in terms of managing their health care and eventually well-being, I think that will be the revolution for the NHS, is when your healthcare is in your hands and you're able to manage it, via technology. It's going to open up a huge amount of opportunities, but equally we've got to be mindful of making sure we're considering the challenges and inclusive in our approach.
I'd second all of that and just build on it, but also really levering the potential of data in how we could do, using that data not only to better respond and give better healthcare, but also that using that data for more upstream interventions along pathways, but also to better plan plan our health and care services more broadly. So I think that's a huge potential. And when we've got those data sets, how can we make use of it by using some of the new technologies like AI and the like to actually mine it and turn it into usable insights in a very rapid and quick way as well.
And I think, given that you've stole some of the big ones, both of you, I'd probably I'd build on something that Sonia said. I think we absolutely, it'd be a fantastic place to be if patients and the general public were able to manage their health better digitally, but not in a variety of apps. To be able to use, like you say, whether it's the NHS app, to use one place where they can access everything from nutrition to how their endoscopy is going to be performed. I'm hoping that with the move to ICS, there's only 42, there is that kind of collaboration, that what we don't create is an app for everything. that what we find is a central place that we're able to access and support patients to manage their health better. I don't think we can lose sight of some of the small wins. Letting we talked about the 3D scanners, the VR, some of those smaller ones, rather than have everyone feeling they have to, suddenly find money for a massive robot. It's how can we support clinicians to make, those step changes through some of the really smaller investments, but that actually do see in scalability massive increases in terms of investment versus the return on investment for some of those small areas.
You're right. We've been given the opportunity. We've now got to make the most of it.
Thank you to Nicci, Mike and Sonia, and thank you for listening to HFMA Talk. This episode forms part of the HFMA's Delivering Value with Digital Technologies programme, and you can find out more about the programme and access resources, case studies and briefings on the HFMA website.